The respiratory system, also called the pulmonary system, is the power source and actuator of the vocal instrument. The lungs serve a function similar to the bellows of a pipe organ or the air bladder of bagpipes. This is not the primary biological function of the respiratory system, of course. First and foremost, it serves to oxygenate the blood and cleanse it of excess carbon dioxide to maintain life. Let's take a look at respiratory anatomy, beginning with the skeleton, our framework. The respiratory system is housed in the axial skeleton, which consists of the spine and rib cage. We have 10 pairs of fixed ribs and 2 pairs of unattached ribs. You can see them floating underneath. The proper term for our ribs is costae. The spine consists of 24 stacked vertebrae. The bottom 5 are called the lumbar vertebrae and are the thickest. The thoracic vertebrae make up the next 12 segments of the spine. The 7 cervical vertebrae complete the top of the spine. As you can see, they are the smallest vertebrae. When we think about breathing, the very first thing that comes into our minds is our lungs. The lungs are organs, and as such, they are not capable of voluntary movement on their own. When we inhale deeply, we do so because we expand the rib cage and lower the diaphragm. This forces the lungs to open and expand, thus allowing air to rush into them. The diaphragm is the most important muscle of inhalation or inspiration. It is a large dome-shaped muscle that bisects the body, separating the thorax from the lower abdomen and viscera. This is a view of the diaphragm from the top. You can see that it fills the space almost entirely. This is a view of the diaphragm from the front. You can see the spaces where the lungs would reside. By lowering the diaphragm, this space is greatly increased. The diaphragm flattens when it descends. The second significant group of inspiratory muscles are the external intercostals. Intercostal means between the ribs. In this case, external means the outermost muscles within the rib cage. The external intercostals are responsible for pulling the ribs open, thus creating space for lung expansion. They are strongly voluntary muscles. With practice, you will learn to increase your lung capacity and draw breath simply by opening your ribs using the external intercostal muscles. There are 2 major sets of expiratory muscles used for exhalation, the abdominals and the internal intercostals. On inhalation, the external intercostals contract, lifting the ribs and opening the thorax. On exhalation, the internal intercostals contract and the diaphragm relaxes, lowering the ribs. This makes the lung space smaller, forcing air to move out of the body. There are 4 pairs of abdominal muscles that play important roles in singing. The first set is the transverse abdominals. As you can see, the transverse abdominal muscles form a girdle or sheath around the waistline at a very deep level. Many singers find it very effective to activate these muscles while singing, creating an upward motion of the stomach and a positive antagonism of all the support muscles. The rectus abdominal muscles run straight up and down on the front of the thorax. The primary function of these muscles is to shorten the distance between the pubis and the sternum, exactly what we don't want when singing. One of the most common problems we find with beginning singers is tension in the rectus abdominal muscles, which prevents the free, buoyant expansion of the rib cage and creates a tight, strident tone. While a ripped six-pack looks fantastic, it doesn't do anything positive for singing. Beware of tension in this muscle group. The last 2 pairs of muscles we will look at are the external and internal oblique abdominals. The external obliques run downward toward the center of the body and assist in shortening the torso. Great for exhaling, but not so great for good singing. The internal obliques run from the groin to the ribs. Their primary function is also to shorten the torso, but many singers enjoy stretching these muscles open consciously on inhalation and then maintaining that stretched position during exhalation. I mentioned positive antagonism earlier. This is a very important concept for singers. Muscles come in pairs, like the internal and external intercostals. You remember that the external set is useful for lifting and opening the rib cage on inhalation, and the internal set helps lower the ribs and create exhalation, right? Opposite functions. When we create positive antagonism, we gently activate both sets at the same time, and this creates a buoyant, vibrating instrument for singing. Now, before you get all anxious about that concept, relax. You create this positive antagonism more often than you realize. When someone throws you a ball, your whole body gets ready to catch it, right? That is positive antagonism. Just before you undertake a stag leap and dance, you create that positive antagonism again. It is a wonderful natural phenomenon, and singers learn how to consciously cultivate that antagonism in all the muscles of inspiration and expiration. This creates readiness, and it's an essential part of breath support. So that's it. You have now been introduced to the most basic elements of the anatomy of respiration. Memorize them and make yourself an expert on this topic.